Hello everyone, and thanks for joining in. Today we'll be discussing respiratory system infections, chapter 22. The respiratory system is complex and made of many different parts. It can be separated into two categories, the upper respiratory system and the lower respiratory system. The upper respiratory system contains the nasal cavity, oral cavity, pharynx, epiglottis, and larynx. And the lower respiratory system contains the trachea, the lungs, which have different areas, the upper lobe, the middle lobes, and the lower lobes. This image zooms on the upper respiratory system and pays special attention to the sinuses, the nasal cavity, and oral cavities. The pharynx, also known as the throat, and the larynx, which is your voice box, and tubes associated. And the epiglottis is the flap of tissue that covers your trachea when you swallow. There are many diseases of the upper respiratory system. Any disease that you see that ends in itis is an inflammation of that region. So the pharyngitis is inflammation of the mucous membranes of the throat. Laryngitis is inflammation of the larynx that affects the ability to speak. Tonsillitis is inflammation of the tonsils, sinusitis of the sinus, and epiglottitis is inflammation of the epiglottis. Here's an example of the epiglottis here. We'll be covering bacterial and viral infections. Bacterial includes streptococcal pharyngitis, scarlet fever, diphtheria, and otitis media. And the viral includes common cold. So streptococcal pharyngitis, also known as strep throat. It's caused by group A. Streptococci pyogenes is the only member of group A streptococci. They're resistant to phagocytosis, produce streptolysins and streptokinases. The inflammation of the pharynx and fever are present. It's often accompanied by tonsillitis and swollen lymph nodes of the neck. And it is typically treated with penicillin or penicillin-like antibiotic. Okay, let's discuss scarlet fever. It is a streptococcal pharyngitis wherein lysogenized or destroyed S. pyogenes produces an erythrogenic toxin. Erythrogenic means it causes reddening, hence the name scarlet fever. Its usual signs and symptoms are accompanied by a pinkish red skin rash and a spotted tongue that later becomes red and enlarged. It may also be linked to streptococcal skin infection. And while we're discussing toxins creating diseases, let's talk about diphtheria, which is caused by lysogenized Corynebacterium diphtheriae, which produces a potent exotoxin. The exotoxin is extremely important in the diphtheria, tetanus, and pertussis vaccine. There are now 5 or fewer cases of diphtheria in the U.S. yearly. It causes leathery grayish layer of fibrin and dead tissue in the throat. And it looks something like this. Before 1935, this was one of the most deadly infectious agents among children in the United States. And now it's protected against by the DTaP vaccine. Next, otitis media. This is earache. It's infection of the middle ear. It's caused by S. pneumoniae, H. influenzae, M. catarrhalis, S. pyogenes, or viruses. It has a pus buildup which puts pressure on the eardrum and causes inflammation. It's most common among children, however, where the auditory tube is smaller and more horizontal.
Checkpoint 1. A patient presents with a hardened layer of gray tissue in the back of the throat. What is the likely etiologic agent?
Okay, next let's discuss the viral. The common cold. It may be caused by one of greater than 2,000 viruses. This mostly infects the upper respiratory system. Body temperature might be slightly lower than human body temperature where it thrives the best. As few as a single rhinovirus virion can cause a cold, and virions can remain viable on surfaces for several hours after they have been shed by a host. Antibiotics are typically useless because the etiology is viral. About 30 to 50% of them are rhinovirus. About 10 to 15% are coronavirus. So since the temperature that it thrives in the best is a little bit lower than human body temperature, that's why you typically find them causing upper respiratory system illnesses. Correlation between cold weather and incidence of colds is not well understood, although cold and dry environments may help to preserve the viruses. So now let's discuss the lower respiratory system a little bit. This can include the trachea, which is the windpipe, and structures of the lungs, including the bronchial tubes and alveoli, which are air sacs that exchange carbon dioxide and oxygen gas with red blood cells between the circulatory system and the environment. So we have three different categories to discuss: bacterial, which could include pertussis, tuberculosis, and pneumonia; viral, which could also be pneumonia; respiratory syncytial virus, and influenza; and then fungal, histoplasmosis, coccidioidomycosis, pneumocystis, pneumonia. Sorry about that. Okay, pertussis. Pertussis is also known as whooping cough. It's caused by encapsulated Bordetella pertussis. They attach to the ciliated cells in the trachea and inhibit the ciliary escalator and releasing toxins. So remember, the ciliary escalator are those cells that move their cilia in order to push the mucus up out of the lungs. The catarrhal stage is a common cold-like stage, and then the paroxysmal stage is an intense, violent coughing. And it's actually the pertussis toxin that causes the symptom of disease. Okay, next up is tuberculosis, which is caused by Mycobacterium tuberculosis. It was believed to have been responsible for about 20 to 30% of the deaths in Europe in the 17th to 19th centuries. Today, we have a very low incidence in the US, and most cases are acquired abroad. It's very slow growing and has a waxy cell wall which is resistant to many antimicrobials. It infects and multiplies within macrophages. One can accomplish the Mantoux test, which is used for diagnosis. And this tests for an immunogenic response to a purified protein from M. tuberculosis, which is injected into the skin. Multi-drug treatment is used for at least 6 months in order to treat tuberculosis. The incidence of tuberculosis is greater than 10 million per year, so it is considered a pandemic. This shows a global map of incidence in 2016 per 100,000 population. The very dark colors you see in this map are greater than 300 per 100,000, or greater than 0.3%. So we see it has a strong prevalence in part of the East, in Africa, Mongolia, and then throughout Latin America, Europe, the rest of Northern Africa. So it is spread globally. Okay, now let's talk about typical bacterial pneumonia. 2/3 of cases are by encapsulated Streptococcus pneumoniae or pneumococcal pneumonia. It includes inflammation of the bronchi and alveoli, resulting in high fever, difficulty breathing, chest pain, blood in the lungs, and with antibiotic treatment, mortality is 5 to 7%. There's a bit of a typo there. Mortality is 5 to 7%. Vaccine prevents up to 13 types of pneumonia.
Checkpoint 2. Which disease is caused by a pathogen that inhibits the flow of mucus by adhering to esophageal cilia?
Okay, now let's discuss viral causes of lower respiratory systems, pneumonia, and influenza.
Viral pneumonia is usually caused by various enteroviruses and often is a complication of a primary infection of the flu, measles, or chickenpox. An emerging cause of viral pneumonia are the coronaviruses, and there are a few that we want to cover. One is what's called SARS, which is severe acute respiratory syndrome, and it is transmitted from horseshoe bats. The only known outbreak was in 2002 to 2003 and affected about 8,000 and caused about 900 deaths. Next is MERS or MERS-CoV, which stands for Middle East Respiratory Syndrome coronavirus, which was thought to be transmitted from camels and has a high mortality rate but is not highly contagious. And then lastly, one that we're all very familiar with, COVID-19, which stands for Coronavirus Disease 2019, when it was discovered. The origins are still being studied at this time, and it does have a low mortality rate, although it can um, definitely affect those people who are at-risk populations, but it is highly contagious.
Okay, influenza. Influenza viruses can be caused by type A and type B, which cause seasonal epidemics, and type C causes mild non-epidemic illnesses. They exhibit antigenic drift, which means they rapidly mutate and thereby they evade host immunity, therefore requiring a new vaccine every year. And it has a low mortality rate, less than 1%, but high incidence, which leads to large numbers of deaths, especially among infants and the elderly.
Checkpoint 3. If measles virus exhibited antigenic drift, how would the approach to prevention have to change? And the last pathogenic group that we need to cover for diseases of the lower respiratory system are fungal pathogens, in particular coccidioidomycosis. And it is sometimes simply referred to as valley fever or San Joaquin fever because that is a bit of a mouthful. It is caused by the fungus Coccidioides immitis, and it is transmitted through inhalation of airborne spores. The symptoms are chest pain, coughing, fever. Signs can be weight loss. And it causes these spherules full of spores to develop within the tissue. And it's a growing incidence in the Southwest due to drought and an aging population, as well as just more people living in the American Southwest as well. And that brings us to checkpoint 4. What fungal respiratory disease has growing incidence in the southwest of the United States, and what is the name of the pathogen that causes it? And that is the end of this chapter, chapter 21. Thank you so much for joining us, and we'll see you during the next one.